Good morning. Welcome to Empowerment Through Leadership, Building Resilience, an official UN parallel event for the 66th Commission on the Status of Women. I'm Farida Jalalzai, Professor of Political Science and Associate Dean of Global Initiatives and Engagement at Virginia Tech. Our panel today highlights the role of women's leadership in response, recovery, and rebuilding efforts as COVID-19 continues to present challenges across the globe. We are here to assess strategies, engage and inform, and facilitate meaningful participation to address inequities. We really hope that our discussion today will help in any way to define and even redefine leadership to include traditional and non-traditional leadership roles in various political settings, including academia, and also serve as a working session for scholars, practitioners in the field, and for decision makers. This event is a joint partnership between Blue Ridge Impact Consulting and Virginia Tech College of Liberal Arts and Human Sciences. I'm really excited that you've joined us today. We have four of my esteemed colleagues who are panelists with us. I will be co-moderating along with Dr. Katie Powell. Each panelist will start by offering opening remarks for about 10 minutes. After this, the moderators will pose questions to the panelists, and then we'll shift to audience questions. Some questions we've already received ahead of time through the registration process, and others the audience will be able to submit through the chat box. I'd like to first introduce Dr. Jennifer M. Piscopo, who's an associate professor of politics and director of the Center for Research and Scholarship at Occidental College in Los Angeles, California. Her research on gender and women's political representation and participation has appeared in over 20 peer-reviewed journals, including the American Journal of Political Science, Politics and Gender, and Comparative Political Studies. She's also been a part of numerous edited volumes. She consults extensively for international organizations and has recently authored flagship reports for UN Women and United Cities and local governments on women and gender and COVID-19 response and recovery. Her writing on women and political empowerment has appeared in outlets such as the New York Times, the Washington Post, the Los Angeles Times, the Boston Review, Ms. Magazine, and Smithsonian. Please welcome Dr. Jennifer Piscopo.
Thank you, everyone. Good morning or good afternoon. Thank you, Professor Jalalzai, Virginia Tech, and Blue Ridge Consulting for inviting me to join you today. I'm really excited. And what I want to do in my 10 minutes is I want to just take a quick tour through women leadership and COVID-19 response and recovery. And I'm going to go ahead and set my timer. So I want to start actually at the very beginning of the pandemic. It feels like a century ago. It was only 2 years ago, right about this month when the COVID-19 paralyzed the globe. And so a media narrative really quickly emerged that countries that were led by women seemed to have better outcomes at containing the coronavirus. Now, going back in time, what did this mean 2 years ago? It meant lower case counts and, of course, lower mortality. And so as someone who has spent a lot of time studying the effect of women political leaders, I was actually not very excited by this narrative. I was a little bit skeptical of it. And in fact, I wondered if the connection that pundits and journalists were picking up on between women leaders and pandemic performance was in fact a spurious correlation. So what does a spurious correlation mean? It means that there's actually some other factor that's explaining both why countries elect women and why countries might be performing better at containing the pandemic in those first few months. To take a closer look, when COVID-19 paralyzed the globe 2 years ago, there were only 11 women that were holding the sole or chief executive office at any one time. And so that's already a small number of women. And in fact, most of these women governed in global north countries. So they were leading countries like Iceland, Germany, Finland, where we saw high levels of citizen trust in government and where countries had high performing bureaucracies. So I argued that it was actually these conditions that led countries to perform better in the pandemic and might also explain at that moment why those countries were electing women. So there was not an automatic straight line between leader gender and pandemic performance. And I think we see that even more 2 years on as countries' outcomes relative to COVID-19, both in terms of public health and in terms of economy, have diverged even more wildly. But why was this narrative so compelling? It transformed some ideas that people held about which kind of leader was competent during a crisis. So we tend to associate greater competence with men leaders because men have historically held executive posts across the globe. And so the contrast between bumbling men like Jair Bolsonaro and very competent women like Jacinda Ardern was deeply compelling. But the reason why I was skeptical about it was not just to make a political science point about a spurious correlation, but was to suggest that sometimes elevating women as superheroes can have some downsides. It can create unrealistic expectations for the ability of women to save situations. And we know that there can be possible backlash effects when women fail to turn crises around. That said, leader gender during the coronavirus pandemic may still have mattered. So I had the opportunity to work with Malaga Oak on this UN Women report. And what we did in the UN Women report was we looked not just at chief executives, but beyond women in chief executive roles to women in a variety of executive and legislative leadership roles at the national, but also the subnational level. And in this report, we focused on a qualitative analysis. So we were not explicitly contrasting outcomes in countries with women and men or outcomes in territories with women and men, but looking at what we could generalize from stories about where women leaders in all of their roles had been successful. And we come up with 3 trends. So we find that women did generally exercise effective leadership. They responded rapidly to the crisis in the pandemic's first year, and they were generally likely to ensure that their COVID-19 response and recovery was socially inclusive, meaning it was addressing not the immediate public health crisis, but also the broader social and economic effects of lockdown on citizens, and particularly the most vulnerable ones. And here we really zeroed in on the subnational level. And we were actually particularly interested in women at the subnational level, women governors, women mayors, and local elected officials who were in countries where the chief executive, and these were largely men chief executives, who took dramatically different approaches to the COVID-19 pandemic, meaning they simply ignored it or hoped it would go away. So we developed more research looking at how women leaders in 6 countries where there were populist men chief executives who glossed over the pandemic at the helm. We looked at India, Brazil, Japan, the US, Philippines, and Mexico. And we looked at how these women were able to navigate the politics to push their cities or their provinces and states into more comprehensive and inclusive pandemic responses. I want to pivot now, and I should say I'm happy to go more depth into any of these questions in the Q&A, but I'm trying to give an overview of where the international conversation and the research has been. So now I want to pivot away from the role of women leaders to think more broadly about a gender responsive pandemic-19 recovery. So we in this call are probably familiar with some of the gendered effects of the pandemic. So for instance, most frontline workers are women, but 2 years later, personal protective equipment still does not fit women's bodies. We know that there has been a dramatic exit of women from the workforce. So worldwide, women lost 64 million jobs or $800 billion in earnings in 2020. And this is because lockdowns, school closures, dramatically increased the need for unpaid care work. And in all countries across the globe, it was predominantly women who answered this call by exiting the workforce. So we have a crisis of care, and we have data from across the globe that shows that women have increased domestic burdens and are more likely to have experienced negative mental health effects. And of course, the shadow pandemic of violence against women and girls. And I want to say that 2 years on, I'm in the United States and we might all be taking our masks off, but the pandemic is not over and the gendered effects are going to linger. For instance, in January 2022, the US economy, which is bouncing back, added nearly 500,000 jobs, but still only 188,000 of them went to women. So these gendered effects are still very pronounced. Why have countries failed to think more globally about the gendered effects of the pandemic? We can see that women have been dramatically underrepresented on the national COVID-19 task forces that have been convened to make policy in response to the pandemic. So all this focus on women leaders, which is really important, is obscuring a broader pattern where whether it is at the national or subnational level, women are still underrepresented in political decision-making. A consequence of that is that only 8% of only 8% of economic recovery plans across the globe have addressed unpaid care work. We see that economic recovery is instead emphasizing male investments in male-dominated sectors like construction and technology. Think in the United States about the failure to adopt universal childcare, but investments in infrastructure. And in fact, governments are relying on the unpaid or underpaid labor that women do in the home, in grassroots organizations, in the community to sustain pandemic recovery, but they're not making any investments in the pandemic and ameliorating the pandemic's gendered effects. But it's not because they don't know what to do. So early in the pandemic, the state of Hawaii was the first entity where grassroots women's groups in collaboration with state policymakers developed a feminist economic recovery plan. And it has drawn on past experiences with ignoring the gendered dimensions of women during a crisis in recovery, like the 2008 and 2009 financial crisis. These plans envision building back better by asking for big structural changes like dramatic investments in childcare and care infrastructure and dramatic investments in solving violence against women. We've seen feminist recovery plans be articulated in a variety of grassroots and national contexts, from Africa to the Philippines to Northern Ireland, and they've become important advocacy tools through which intersectional coalitions of women have been lobbying governments for change. Even international organizations have articulated their own feminist recovery plans. And the question is, are they gaining any traction? And the short answer is they are not. These plans are advocacy tools, but we see very few cases where they're being taken up by national or local governments. In my last minute, I just want to highlight a few exceptions to that rule to show that if political will is in place, whether or not there are women leaders at the helm, we do see change. So I want to highlight Argentina and Canada as two of the exceptions to this trend of ignoring women in recovery. So Argentina has installed what they call a gender cabinet, and 15% of the 2021 budget, amounting to 3% of the country's GDP, has addressed pandemic-induced gender inequality, including, for instance, a recently introduced pension scheme for homemakers who never hold a job but dedicate themselves to informal, unpaid work in the home can access the pension plan. And in Canada, we do see large amounts of investment in childcare, early childcare learning, and even a women-only task force on economic recovery. At the subnational level, I want to highlight the city of Bogota. Claudia Lopez is the first woman mayor of Bogota. She's also an out lesbian who's married to her partner. And in response to the pandemic, Bogota introduced what they're calling the district system of care. They are publicly funding care services within a 30-block radius of all households, including childcare, elder care, respite services, food kitchens, and laundries. And they are actually funding care workers to go into the homes of marginalized individuals and assist with domestic work. So Bogota is one instance, and I would say it's the only instance based on my extensive work with international organizations that has focused on converting care into a public good. So to conclude, where are we now? I want to push us beyond the women leaders are better narrative, because we need to focus on the fact that women still generally lack decision power, and women's and feminist groups still lack policy influence. And so the vast majority of pandemic recovery, notwithstanding the examples I've elevated here, is gender blind. And I am afraid that the rush to declare the pandemic over will only exacerbate the lack of action on the underlying issues. So I want to end by calling attention to a piece that I wrote in the Washington Post 2 weeks ago. And when you write these pieces, you don't get any control over the headlines. And so this was the headline that was chosen for my piece, which was reminding us that the pandemic has hurt gender equality. And around the globe, activists and policymakers have laid out plans for economic recovery that would help reverse the losses. But actually, my argument in the piece was that no one is listening to these plans. So I want to end with what I thought was more of the punchline in the piece than my headline suggested, which is that it's worth reiterating a few facts as we sit here for CSW 66. Governments have the data on how the pandemic has disproportionately affected women. They know what policy tools will solve the problem. What they haven't done is act. So thank you very much. And I look forward to hearing from the other speakers and continuing this conversation.
Thank you so much, Dr. Piscopo. That was excellent. In terms of the next panelist we're going to hear, I am very pleased to introduce you to Dr. Nadia Brown. Dr. Nadia Brown is Professor of Government, Chair of the Women's and Gender Studies Program, and an affiliate in the African American Studies Program at Georgetown University. She specializes in Black women's politics and holds a graduate certificate in Women's and Gender Studies. Dr. Brown's research interests lie broadly in identity politics, legislative studies, and Black women's studies. While trained as a political scientist, her scholarship on intersectionality seeks to push beyond disciplinary constraints to think more holistically about the politics of identity. Please welcome Dr. Nadia Brown.
Well, thank you so much, Dr. Jalalzai, and again to my fellow panelists and Blue Ridge Consulting. I am delighted to be here to share with you some of my research. So I am, as Dr. Jalalzai mentioned, I am an expert in Black women's politics. And my presentation will echo a lot of what my colleague, Jen Piscopo, just shared. And as Dr. Piscopo laid out some of the gendered barriers to crisis recovery through COVID-19, I will talk using my own research to showcase how women of color in the United States, but particularly Black women lawmakers, are confronting and dealing with some of these challenges. And I'll use interviews and narratives that they shared with me on some of the problems that they're facing in trying to push forward this recovery response. So, oh, I missed a slide, sorry. And so to put a finer pin on some of the things that are happening for women, and particularly Black women, Latinx women, Asian American women, Native women, and women at the intersections who suffer from being differently abled or disabled, that we have to remind ourselves that the United States healthcare system is built on a legacy of slavery, ongoing anti-Black racism, and ableism. And so I'm going to kind of talk us through kind of how we got here to these health disparities, because I think it helps to frame what the legislators themselves are up against and what they're trying to confront. So this is a multi-tiered issue. It is a problem. The pandemic just happened to highlight some of the persistent inequalities that women of color, low-income, queer women, women of color, disabled women face on a day-to-day basis. And so it's worth to remember, right, that the eugenics movement in the United States had a disproportionate effect on women of color, and particularly women who were low income, right, which sometimes tended to be the same thing. So there's a history of forced sterilization on women of color. And actually, this was part of the United States laws. Up until 1970s, the United States could legally sterilize Native American women. There is a deep distrust of the medical profession for communities of color, and particularly for women of color. So the Tuskegee experiment is where Black men were either injected with syphilis or had syphilis, but were not treated. So they were coming in to doctors' offices thinking that they were going to be treated, but instead the doctors were just seeing what happened if you let syphilis run in someone's bodies unchecked. Those men then gave syphilis to their partners, and so women unknowingly, right, contracted syphilis. Henrietta Lacks has gained much attention here in the United States. Was a woman who was suffering with cancer, and turned out that the medical establishment, actually here very close to where I am at Johns Hopkins University, took cells from her body and studied them and found out that they were remarkable in recreating themselves. And so a lot of modern day medicine around what our bodies do really comes off of the helix cell, which was from Henrietta Lacks. And her family had no idea that the cells were being taken, that there have been decades worth of research done on her cells that really helped to cure ailments that many Americans faced and didn't know this. Next, the modern gynecology movement is based on the backs of Black women that the father of gynecology practiced on enslaved women, women that were newly freed or low income, and did so in very brutal ways because there was a belief that Black women did not endure pain. And so the things that we now come to have in our medical precedents of gynecology actually comes on Black women as experimented on. And so this history, and it just helps to showcase how African Americans in particular are really distrustful of the healthcare profession. But that doesn't stop there, right? So some of these things are historical, but there is still present day medical mistrust. And I'll talk a little bit about that and how legislators are trying to combat this. There's also this lack of intersectional healthcare, right? And so the data that Jen Piscopo shared was global and also kind of fit a little bit on what happens here in the United States. But in actuality, there is limited data on the impact of COVID-19 on intersectional groups, right? And so as Professor Pisco mentioned, right, we're 2 years into the pandemic and there's still not PPE that fits women's bodies. And that's one example, but there's also last study on what does COVID-19 do differently on Black women's bodies that we know have a history of different medical ailments because of their distrust of government, lack of preventive care, and the role of racism on exacerbating health and healthcare. Next, healthcare in many low-income communities and Black and Brown communities is often inaccessible. So preventive care is lacking. There are medical care deserts in these communities. But the real nuance here is that poverty, income, housing, and food insecurity, as well as racism, exacerbates already existing health issues. And so to take out or to remove someone from the context of their situation and just talk about, well, why do you have diabetes, doesn't get at the fact that they might live in a food desert or someplace where it is difficult for them to obtain fruits and vegetables, or they might live in a place that has environmental toxins like lead in the water, right? And those tend to happen in lower income communities or communities that don't have the resources to fight for themselves, to advocate for better environmental health. And then next, right, the United States is really pushing vaccines, but there is a disproportionate amount of communities of color that are getting vaccines. And what some legislators have talked to me about is that the Biden administration is really pushing vaccines without saying, how do we get you the vaccines? And so it's not just enough to deputize communities, representatives of color into communities of color to say, get the vaccine, it's safe, it's healthy, it's known to prevent the spread of COVID-19. But where are you going to get this vaccine, right? Do you have a local a pharmacy here in your neighborhood that can give this to you? Do you have access to a primary care physician that can give you the vaccine? So these are things that have really been missing from these larger conversations. And because of these overarching health disparities, that is one of the reasons why people of color are experiencing COVID-19 at a higher rate. So now that we have entered into this phase of COVID-19 recovery here in the United States, like my colleague, Dr. Pisco mentioned, right, where the United States is relaxing mask mandates, it is really essential to see how there are differences in how this rollout of being over the pandemic looks like. So economists have shown that essential workers are burnt out, and essential workers are those that have been working constantly with face-to-face time during the pandemic, right? So starting back in March 2020, they weren't allowed to work from home like I am because they are crucial to the ongoing of the economy. People that work in meat processing factories, those that clean rooms or office buildings, those that are restaurant workers, right? And particularly I'll talk a little bit about this towards the end, but those who are healthcare workers. And they've done so often without the necessary protective equipment to keep them safe from COVID-19. And they are just simply burnt out from being on the front lines. And they've also contracted, many cases, COVID-19. As Professor Piscopo mentioned, right, there's this lack of childcare, and there are already data that is showing that children of essential workers, particularly low income and women of color, and oftentimes single parents, Black women, Latinx women who are single parents, their children are falling very far behind school and have a host of social and emotional issues. And because these women have faced a lack of childcare, but they are forced to go back to work in order to make ends meet, where are their children left? And I'll talk a little bit about this, that there, even within this recovery period where there's an expansion of the economy and there's an opening up of job opportunities, Black women in particular are still facing hiring discrimination, right? So employers are using tactics and tools to try to conform or mold Black women into what they think these essential workers should look like, or not hiring them at all. So I'll talk a little bit more at length about the legislative responses, and these come from my interviews with particularly Black women, state legislators, and also Congresswomen. So the Relief Act is something that has passed its way through the Maryland State House, which is a state here in the United States, that Black women in particular pushed, and they worked with the Latino caucus and the Black caucus and hoped to try to get the Women's Caucus on board, but they had some difficulty doing that. But what they were trying to do was the federal government to pass a COVID release bill that was really only applicable to United States citizens. And what these Black women state legislators did, what they tried to, and they successfully did, was get the state of Maryland to enact a bill that would give those same benefits, but not at the federal level, at the state level, to low-income immigrant taxpayers who do not have a Social Security number. So this is undocumented Americans. And what these women were so passionate about were that many of these undocumented workers were women, right? And they were the ones who were doing the child care. They were the ones who were doing the domestic care in the state of Maryland with little recognition, but needed the assistance that the federal government and the state government will later provide to those with documented status. And in a kind of a theoretical, unprecedented move, these women worked to partner with the Black caucus and the Latino caucus. And this was different because in the state of Maryland, there aren't as many Latinas, and the Latino caucus is actually one of the smaller caucuses. The Black caucus has a lot of political clout in the state of Maryland. So they pushed both their colleagues on the Black caucus side who didn't think that this bill mattered or impacted them, and worked with the Latino caucus to shore up the numbers so that they would have enough votes to pass this bill and get it sent to the governor's office. And so what these women have told me is that for the Black legislators, they thought about immigrant women as being from Central America, Latin America, and not being Black women. And what these Black women lawmakers said is it doesn't matter who these women are, but also, right, these are women that are also coming from the Caribbean and Africa, that we have a lot of members here in our district that are these undocumented Americans. So while the national face or the picture that Republicans here in the United States want to paint of undocumented workers are as Latinx Americans, there's a good number of Black Americans here in the United States that also fall under that as well. The next is the Crown Act, and the Crown Act is a piece of legislation that is making its way in many locales. It's local city municipalities, state government to the federal legislature. Congress the House of Representatives just passed the Crown Act. Now it's trying to make its way onto the Senate and then hopefully to President Biden's desk. And what the Crown Act is, it is a law that prohibits race-based hair discrimination. And so that says that anyone who wears their natural Afro textured hair, like mine is, in a protective style, like dreadlocks or locks like mine are, could be fired because their hair is not seen as fitting under employment codes and protocol, or it's seen as being unprofessional. And so while while employers are trying to ramp up and get the United States economy back on full scale, they were discriminating from Black women in particular who had protective hairstyles or natural hairstyles like mine that was outside of the company code. And so what this Crown Act has done is said that you can't do this anymore. So while the United States, again, is having a shortage of workers, Black women who were looking for employment were being discriminated against and not hired because of how their hair naturally grows out of your head. And Black women have been championing this bill in several states and localities. And in Congress, there are a Black senator, Cory Booker, who was pushing this because, as you know, right, there are no Black women senators in Congress today. And then lastly, the Mental Health Momnibus is a bill that Representative Lauren Underwood is shepherding through Congress, through the help of the Congressional Caucus for Black Women and Girls, that is making sure that COVID-19 bill relief money can be used to improve the mental health for Black women and Black people that give birth. And there have long been studies around different rates in Black maternal health, but much has not been done, right? And what the legislators I talked to in my studies state is that this issue was seen as too niche, right? So that the Black Caucus and Women's Caucus did not necessarily see a reason to coalesce behind this. And it was really Black women who had to take this upon themselves to push this through Congress. And I'll end with this. So there's still a need for more. So my talk really centered on what the women themselves are doing and thinking about the context in which they're working in and the bills that they're trying to push. But now let's talk about them, right? They're burnt out. They are tired, the same way that many of us on this call are, who are dealing with parenting duties and your professional duties. They're dealing with the same thing, right? The other thing that is that's different, or that I found to be different in this particular political time, is that the Black women legislators are still reeling from political violence that they faced after the attempted coup attack on the United States government. And so these women have PTSD. So they're trying to do their jobs, right, as congresswomen with colleagues who have openly called for their murder, right? And this is something that we don't study as much in the United States, political violence against women, and particularly women of color. But these women faced very distinct racialized and gendered attacks, right? From being called for claims to say, lynch that Black bitch, right? So very, very distinctly racialized and gendered forms of violence. And then these women are expected to go back and work next to those colleagues that have called for those things. And so I had much difficulty trying to schedule interviews with these legislators because they were dealing with such, they were just dealing with PTSD. They've also faced very challenges in trying to pass the human infrastructure part of Build Back Better, something that they took back to their constituents to say, elect me, and I'm going to make sure that there are these bills that will help you and your communities run better. And that would have been particularly of use for low-income and Black and brown communities, just haven't made it. And then I'll end with this, that in the state legislatures, particularly those that have large Black populations and are led by Republican supermajorities, these Republican states have started passing restrictive bills on voting rights and are also redistricting these maps that are particularly hard-hitting for Black women elected officials who have taken over seats in districts that used to be Republican, like Lucy McBath, who was a mother of the movement. Her son, Jordan Davis, was murdered outside of, and she's an elected official outside of Atlanta, and is the affluent kind of middle-class mixed neighborhood. And she might not be reelected, right? And this is a very, very targeted way of drawing her out of her district, but then also changing the state laws that make it harder for people to vote. So thank you, and I will stop there.
Thank you so much, Nadia, for your excellent presentation. We are going to go next to Dr. Catherine, or as we call her, Katie Bolzendahl, who's the director of the School of Public Policy and is a professor of sociology at Oregon State University. Her research reflects an enduring commitment to addressing critical questions about political and gender inequality through international and interdisciplinary collaborations. As a quantitative political sociologist, she examines gendered political change over time and in a cross-national perspective, as well as the meaning of family and gender in the political culture of the US and Western industrialized democracies. Please welcome Dr. Katie Bolzendahl.
Thank you so much, Farida. Thank you to all the other panelists and to Blue Ridge Consulting for this opportunity. It's really an honor to sit on this with all of you. Let's see here, get going, a few slides to keep me on task. So I think that the things that I say will really echo what we've heard from our other panelists. And I think that we can all agree that empowering women is the way forward. And so trying to figure out how we can do that is something that we're all challenged with right now. And what I'm building from in my brief remarks here is work that I did actually with Farida and another co-author, Amy Alexander. We edited this volume back in 2018. Jen Piscopo is also a contributor to it, where we really wanted to investigate this idea of how can we think about women's global political empowerment. There had been so much done on women's economic empowerment, but the political empowerment itself was so important. And we defined it as the enhancement of assets, capabilities, and achievements of women to gain equality to men in influencing and exercising political authority worldwide. By understanding that women are coming from a place of fundamental disempowerment, and there is nowhere in the world that women have political authority equal to men. And so why should we expect this to go forward? What are some of the reasons that we want to argue in favor of this? Is, we kind of built around three different axioms, one being that women's political empowerment is not a zero-sum game. So we really wanted to emphasize the ways that empowering women helps everyone and really pushes society forward. And so we spent a lot of time encouraging articles that focused on that and talking about that gender is a major organizing force in social relations across the globe. Now, probably for most of the people on this conference, you're going to say, yeah, we agree. But this is not something that is widely shared in a lot of other parts of society outside of, whether it's US society or other societies. Many people might think that it doesn't matter, that we have solved the gender problem, or that it's just not worthwhile to look at. So really emphasizing the importance of gender as a major force is important. And then finally, that inequalities occur across multiple statuses and other sources of inequality. So we can't look at gender in a vacuum. We have to understand how it intersects with all sorts of different inequalities, as Nadia has spoken to so eloquently. Sorry. Okay, so there's a lot of work that can speak to that, even in that book and from the panelists that we have here today. So I just am going to take an overview at looking at, the work that I've done over my career. How do I substantiate these claims? And then as general patterns, how can they help us understand where we're going? And so if we think about the fact that really women's empowerment, trying to figure out where to put this screen so that it doesn't block me, that we all gain from women's political empowerment. So some of the things that I find from my own work is that gender egalitarianism is linked to a human rights framework and support for family policy support in general, so that when we push for gender equality, we're actually pushing for policies and points of view that value everyone. That women broaden conceptualizations of citizenship norms and political participation. So women tend to have much broader approaches to this, and this helps with pushing forward democratization and the inclusion of a variety of groups of people. And that women's political power drives social policy investment. So work showing that as we elect more women to national legislatures, we are seeing more of this focus on social policy investment in particular as an emphasis. And that's something that Jen talked about in her findings too, in terms of when women are thinking about the COVID response. So how is gender an organizing force for our world? Again, we have to acknowledge the data that we haven't been in a linear pattern toward equality or, you know, the progress kind of framework is really limiting in terms of understanding the challenges that face us. So there continue to be and have long been large gender gaps in support for gender equality. So women are often having to be at the forefront well before the pandemic of trying to push forward these, you know, greater emphasis on equality and gender equality. And so getting more of those men allies to work forward is an ongoing challenge. There are unequal opportunities within legislatures. So I think both Jen's focus on subnational level and Nadia's focus on the experiences of women in color within legislature also really emphasize that. But in my own work, finding that you get women elected to legislature and then there are various power manipulations and things that happen that kind of sideline women and remove them from making decisions that would say, put them on a COVID panel or, you know, put them on a panel that talks about economic recovery. So there's a lot of things that happen. It's not just about getting them in office, but it's also about the power that they have once they're there. And many of the kinds of ways that women choose to engage are often devalued and seen as less important and crucial to political outcomes. So really, there are these multiple layers that keep gender as an organizing force in our world. And then in terms of cross-cutting inequalities in my own work, I've highlighted the importance of religious divisions, of how sexuality and family organization matters for you know, who is seen as worthy of different kinds of family policy and different kinds of recognition, and then definitely for race and ethnicity, thinking about how different racial groups are affected by, in terms of like the lack of recognition for political rights and political responsibilities, and that is not being equally recognized. Sorry, it's a little early in the morning. I'm not quite as articulate as I would like to be. So going to Farida's question about how do we build back better? So knowing that these are all things that are longstanding well before the pandemic hit us, and then the pandemic obviously just took everything back several steps as well. How do we build back better beyond the problems that we've already had? It's a big question, right? Well, we have to invest, of course, in the political pipeline at several different levels. We have to make sure that we're giving young women and girls leadership roles across a variety of different cultural, religious, economic, and racial and ethnic statuses, that we're seeing a lot of opportunities, that finding ways in our community that we can give women and girls those leadership roles. We're seeing the importance of women who model as political leaders, and certainly plenty of research has shown that effect is really important. We can talk about the many ways that we can do politics, that it doesn't have to be one limited model of what it means to do politics. So I don't disagree with Jen that we have good data about how women have been affected by the pandemic, but we often, the questions that we ask when we're collecting data predetermine what the problem is and don't always accurately reflect the kinds of challenges that women are facing, and particularly across different intersectional inequalities. And so, so we really have to dig in, especially, I'm really impressed that Jen has been able to get at the subnational level, but in general, understanding these more localized experiences of inequality have typically far less data, and it's really hard for us to say specific things about what's happening at these levels. And so just to go back to what we've often said too, since, you know, for decades and decades now, the personal is political. And that doesn't mean that it's all just our individual responsibilities we're burnt out. Many of our lawmakers who've been carrying the burden of these, making these cases are burnt out. But these are institutional and structural conditions. So until we can change some of the structural conditions, it's going to be really hard to, to see progress. And so it's really important to emphasize, I would say, that it's not, to finding ways to make structural change. Unfortunately, some of the changes that we tried to push through in terms of childcare, that didn't work out. But to emphasize that this isn't about, women's individual personal problems. And so, there's a lot of lawmakers, I think we all agree with this, but I think we have to be really realistic about the opposition that we're facing in our political realms in terms of trying to convince certain groups that this really matters. So having said that, I just want to thank everyone for the time and for the opportunity, and I look forward to the questions.
Thank you so much, Katie. Last but not least, I want to introduce you to Dr. Amina Zia, who is an adjunct assistant visiting professor of political science and international studies at Virginia Tech. She has served as a UN NGO representative at ECOSOC since 2015. She's the founder of Blue Ridge Consulting, our partner today, and the National UN Experiential Fellowship Program. She's a partner advocate of the UN Girls Education Initiative and introduced the world's largest lesson in partnership with UNICEF to schools in Pakistan. She is a 3-time recipient of the New York City Mayoral Service Award for her stakeholder approach to partnerships. Her research focuses on women's political representation in diaspora communities and focuses on challenges, leadership, and access for women within political party structures. Please welcome Dr. Amina Zia.
Good morning to all, to our panelists, ladies and gentlemen in the audience. I'm excited to participate in today's discussion on fostering women's empowerment through leadership at the 66th Commission on the Status of Women. And of course, thank you, Farida, for your kind introduction and for leading us into this very timely discussion as the COVID-19 pandemic has pushed approximately 120 million people into vulnerable situations. And as we witness a need for more community engagement and participation across the board. I have been part of the CSW community since 2015 when the UN Global Goals were adopted. And for me, it has been a privilege to meet and work with, and of course, learn from some of the most driven and impactful advocates for the representation of women and girls. I am an adjunct professor and also a practitioner in the field. And through the years, I have felt that there is a conversation that is missing from the development space, especially in women's development. And that, as Farida alluded to, one that bridges the gap between scholars and practitioners. I have had the privilege to work in both spaces, and I have served as one of the youngest and one of the handful of women within an executive cabinet as a political appointee in St. Louis County government. And I have also served as a board of directors for national organizations within the local decision and also within the local decision-making space as an advisory committee member in my town. And of course, these experiences have made me recognize that we do need to understand the barriers, the challenges, the power dynamics, the systemic patriarchal systems that exist. And of course, I have stories. And as we collectively find ourselves towards this conversation around how do we build back better and how do we rebuild from the pandemic, I believe we do need to also reimagine the term inclusion, because I feel like we do tend to casually throw that around quite a bit within the policy space, especially as it relates to leadership, engagement, and of course, participation. So I also feel that we need to re-understand or better understand, I should say, what access means and the role of agency, because some of the challenges and barriers to securing representation continue to evolve, as we've witnessed through the pandemic especially. And we need to utilize knowledge, we need to utilize resources as we collectively rise up from one of the greatest health and economic crises of our times. And we also need to make sure that we intentionally carve out a space for women and girls within that core decision-making and leadership as we rebuild back better. I do want to stress that women, all women are change makers in everything that women do. But we also need to realize that we must utilize stakeholder approaches to fostering very intentional partnerships so that we can navigate and harness power dynamics as women. We can leverage information communication technologies to provide necessary resources and, again, access needed for women to become active change makers within communities. And of course, I truly believe that everything starts on the local level. Engagement begins at the very local level. I do want to focus today on the role of political parties. And in the essence of time, I will just quickly go through some of the points. So I do believe that political parties in leadership spaces are very vital. And this is a research and a workspace that I do find myself in right now as we head into the midterm elections. And we have noticed that more women of color are contesting elections, which is a good thing. And we also need to highlight some of the obstacles that women face inside the political party structures. Political parties, as we know, play a very vital role in bringing women forward to the political leadership and electoral offices. And of course, we know that research shows us that women, more than men, do rely on party support for their elections. So on paper, I do want to point out that internal organizational and official documents and statements do provide a very gender equality framework. And they also recognize that strategies do need to exist to combat, so that reform does take place, right, within political institutions that is targeted around supporting women, party activists within and outside the party structures, women candidates, and of course elected officials. But I want to stress that that's only on paper, right? But in practice, we observe that it's a hit or miss depending on the leadership at the time and the political culture and climate of that particular region. So political parties, like any other organizations, do pursue very established strategic and operational goals, and their primary aim is to maximize election support. So the success rests on their ability, on the political party's ability to adapt to environments, which varies across parties due to difficulties, rooted within the parties or within the complexities of the environment. And I would like to argue that, or I would like to state that the same concept applies to women's political participation. As some of our panelists, my fellow panelists mentioned earlier, COVID-19 pandemic has pushed women to engage in conversations at the very local level. We're observing through community organizations, right? And so because we know that women and girls, especially those from very vulnerable communities, are disproportionately affected by the pandemic, we do recognize that there is this need to talk about local participation. We need to recognize and acknowledge that women do not have that access to those very local conversations, right? The conversations around health, as Dr. Brown mentioned, around childcare, I believe as Dr. Piscopo mentioned, to dialogue on food, to dialogue on education, since we know that children are falling behind both on the academic spectrum and also on the social emotional needs spectrum. Conversations around labor markets, as Dr. Piposa, I believe, mentioned that 64 million jobs retained by women were lost around the world. And also the recovery effort plans are focused only a small percent, I believe she mentioned 8%, on addressing unpaid work. So the reality is that women do not have access, right? So we continue to talk about access for women to decision-making, and women are not included in the very leadership corridors. And the reality is that women who are committed to having their voices heard are also navigating everyday commitments like childcare, for example. And I feel like we have mentioned that quite a bit today. I interviewed for my work a congressional candidate who mentioned that she usually ends up having to leave community events early because she needs to relieve the babysitter, which of course means that she's missing out on making post-event connections with participant that could potentially lead to being introduced to a network or to possible funding streams. Another candidate who's running for a local school board, and in order for her to receive recognition from the already established community leaders, she needs to attend party events, but how can she if most events take place in the evening times, which we know if you have little kids or if you're a caregiver for an elderly parent, those evening times are busy and it is difficult to find care. So women have to hire caregivers so they can engage in a conversation on a community level, which of course, as you can imagine, very quickly becomes not a priority on the list and gets pushed back aside. So also, most leadership positions on boards and advisory councils do take place, their meetings do take place in the evening hours, which, as mentioned before, also does not recognize the need for women leaders, right? Women as caregivers, and so as we rebuild back better, it is important to recognize that some of these barriers and challenges that keep women from engaging, from participating actively do exist, right? So if women are not in the rooms to vote or to influence voting on issues like feminist-oriented plans and frameworks, those national and regional and international frameworks, as Dr. Piscopo mentioned, will continue to sit on shelves collecting dust and not gain traction because you don't have women in the room influencing those votes or even voting on those. I hope that we can dive further into this conversation, into this discussion as we around building back better during the Q&A session. Dr. Rosenthal mentioned some intervention modalities around creating pipelines that work on the local level, and also the need to further study women's engagement on that very local level, because it may, and it does vary from region to region. So I will not restate some of the same information, but I am more than happy to address those during our Q&A session. And I'm very hopeful for the commitments and for the recommendations shared by stakeholders as we continue our discussion on how to ensure that we do change our systems towards sustainable and inclusive communities as we reimagine the definition of inclusion on the sidelines of this very 66th commission. And I look forward to a very robust discussion. Thank you.
Thank you so much, Amina. I'm going to introduce you properly to my colleague and co-moderator, Katie Powell. Dr. Powell is a professor of rhetoric and writing and director of the Center for Refugee, Migrant, and Displacement Studies at Virginia Tech. Her research focuses on displacement studies, feminist research methodologies, and feminist autobiography. Dr. Powell will ask the panelists, I think we have time for maybe just one or two questions before opening it up to some of the questions we received earlier and some that we've received in the chat box or I've received directly. So thank you so much. I pass it to Dr. Powell.
Thank you so much. And thank you so much to the panelists for such amazing presentations and the kind of work that you're doing to help us think not only about the urgency of these issues, but also some really practical ways that we might attend to them. And I was really struck by the commonality across your presentations in terms of what Jennifer called in talking about the mayor of Bogota in terms of this issue of care as a public good. And all of your presentations seem to address this in some way, that in terms of having access to those spaces where those conversations are having, not just getting there, because women getting into these spaces and getting elected and having leadership skills and having the background and the expertise to then become leaders in their communities, whether in politics or in other ways, then once they get there, those barriers remain. And so I was interested then to have you all talk about, respond to this idea of care as a public good, with all the evidence that you all presented in terms of issues of mental health, inequities in getting the care that people need, having access to spaces, getting childcare when women need it in order to be in those spaces. If we could talk about the kinds of flexibility and case by case local and the ways that within particular situations there needs to be flexibility, I think, because there's not blanket policy that covers all of this. And that I think I heard that in an undertone in all your presentations as well, is that there needs to be flexibility as well. So basically the question is, how can we talk about care as a public good while also attending to issues of case-by-case bases and the kinds of access and flexibility that we need in these spaces?
Yeah, but thanks, Katie. If it's okay with you, I'll jump in and I'll just offer some thoughts to get us going. Well, I think partly because I wanted to take things up to a little bit more abstract level of just to say that it's also in how we define care. And so I personally believe that we define care too centrally on women. And so when we talk about care is, of course, it disproportionately affects women. I'm not disagreeing with that at all, but understanding that care is something that's a social issue, and it goes back to what I was saying about it not being a zero-sum game. We have a lot of men who are providing a lot of care and a lot of men who want to be involved in that. And so seeing care work and seeing these as societal problems that have to be addressed institutionally, I think is a really important first step, that these are economic issues, that these are political issues, as Amina was saying, in terms of achieving our political goals. So yeah, just to see the care problem as a broader social problem is an important first step, I think.
I want to jump in and talk, give a little nuance, right, that you can't do when you're blowing through 10 slides. So when we look globally, we do see that a lot of initial responses to the pandemic, emergency relief packages. Governments did adopt emergency relief packages at the national, subnational, and local level. And of course, some of them were more comprehensive and with an eye to intersectional dimensions of exclusion than others. But, emergency relief packages did include childcare, right? In the United States, we had the childcare tax credit. We saw a variety of models across the globe. Where, for instance, parts of Africa, there were childcare creches set up in market trading sites, because the majority of market traders doing this informal work are women. So it wasn't that governments didn't know that childcare was an issue. The challenge is that these emergency measures are disappearing, right? And they're not turning into permanent policy solutions, right? And they're not revisioning the way that care works. I want to say the other thing that governments did do, during the pandemic was they also funneled a lot of relief aid to grassroots and community organizations who are actually doing some of the bulk of the work, right? And so I want to give you, I mentioned the Hawaii Feminist Recovery Plan. One of the few policy changes that plan has not been wholesale adopted by the state of Hawaii. It has been adopted by 4 of the 5 counties in Hawaii. It's not an accident that Hawaii was the first territory to release a feminist COVID-19 recovery plan. The grassroots women in Hawaii are diverse, they're intersectional, they represent indigenous groups, women of color groups. And so they had a sense, right, of the vulnerabilities for women at the margins and the need. So one of the few things that came out of the Hawaii plan was there was more funding allocated to some of these grassroots groups to do these care services. So care isn't just taking place in the home, it's taking place in the community. So there was more funding to groups that were, say, delivering maternal child health support in homes. That kind of funding is enormously important, but it still is not transforming our ideas about who is responsible for this work, right? So whether it's the home or the community, governments sure are funding women to continue to do this work, but that's not addressing, as Katie says, the ideas about who should be doing this work and how it should actually be provided. It's still almost a private model, right? Not a public model. And so it's so exciting about Bogota is that it is this public model. And to your point, Katrina, it's not about care as a one size fits all. Bogota's list has 30 different kinds of care services, from childcare, dependent adult care, elder care, to laundry, to food kitchens, and really envisions this comprehensive public position and provision that would flexibly adapt to different needs of different communities and different families. So there is another way of doing it, but we are just seeing so little innovation around that. I mean, Bogota, I've been doing this project with United Cities and Local Government, and I think Bogota is I'm willing to go out on a limb. You know, there might be a city in the Solomon Islands that I'm not aware of, but I'm willing to go out on a limb and say it's really the only innovative model we've seen after 2 years of the pandemic for thinking about the provision of care in a different way.
I would like to add a comment briefly. So as we talk about care, and care is a very personal, is very personal, as we just mentioned. Some of the things that that we just talked about, care is a larger societal problem, and how is that included, or how is that implemented through the relief packages, etc. But something that is a recommendation for an immediate measure is that I wish that we had organizations that allowed women who were interested in participating to take their voice to their local organizations or leadership structures or political parties or town councils, city councils, and let them know that, those traditional rules of engagement are not working. For example, if I have a child with me, it's okay to bring your child to a council meeting, and maybe the council can allow for childcare, right? Just so that person, that individual, that woman, that mother, that caregiver can participate, right? And I think that those are very small measures that can be taken immediately. And, because as we're reimagining what building back looks like, we need to understand that those traditional rules don't work. For example, if a council member or if an advisory committee member is absent 3 times out of the year or out of their tenure, they're bumped off the committee. Well, what if your child is sick, or you have an elderly parent who is sick, those 3 times a year or during your tenure, and then you don't get to say, I'm sorry, like I can't do that. So I think that those are the conversations on the local level that do need to take place. I sit on our Parks Advisory Board, and almost every time I take my 5-year-old with me because I don't have a place for her because I have 2 other little children that my husband takes care of at home while I'm gone to this meeting. So it's for women to have that agency, that ability to say, let's change the structure, because this is my space too, and I want to participate. That is my seat right there, and I am going to take it, and you're going to make exceptions for me, because that's what we need to do. So I wish that as we talk about international frameworks and we talk about national frameworks, that we do come up with some sort of empowerment modality for women to be able to engage on that local level. Thank you.
So I'll quickly add it. At first I was like, do I have anything to say? And I do now. So one of the things that I've been grappling with and haven't got it out of my mind, I was talking with a very seasoned senator here in the state of Maryland, a Black woman who has been in the legislature for almost 30 years. And when I asked her about pandemic relief, she looked at me in all earnesty and said, what pandemic? We've been living through this for years. Like, my community has been living like this with all the things that the United States is now grappling with. That has been my community. And I still, I'm speaking while I'm still processing, right? Because I think that this, that was such a powerful response, because these women, and particularly low-income communities of color, have been battling with the things that have just been exacerbated, that they have known and have been talking about and doing in their communities for decades, right? But haven't been given a seat at the table where they're able to enact policies. They haven't had people listen to them. And even in this structure, right, with this very seasoned legislator, 29 years in the Maryland state legislature, said, what pandemic, right? Someone that's elected to do this work really hasn't been able to do much of this work. So I do think that this has opened up a new conversation to talk about things that communities that have been marginalized, historically marginalized, have been talking about for decades, right? For centuries for some of us, right? And all of these issues are coming to the fore because they are impacting middle class, and in the United States, right, middle class white women, right? And so when issues are affecting their livelihoods, their children, their families, how they're able to make ends meet, this becomes a national crisis, right? And we're saying, oh no, what are we going to do about caregiving? Because the women of color that were taking care of your children right now are having difficulties, but they've been doing this right since, women, Black women in particular, right, set foot on this continent in 1619. So in so much, I say this to say, right, and again, I'm processing, thinking through some of this, right? I think it's turning, sorry, and you probably hear my caregiving in the background. There's a disgruntled 4-year-old. That is her state of being at this point. But like, these are questions that Black women in particular, who have been caring for other people's families, right, have been theorizing about their existence and what they need from the polity. But we're now paying attention to this because those that have been most privileged, that were benefiting from the labor of others, are now grappling with. And so all of these issues are not taking away that women, because of patriarchy, particularly white heteropatriarchy, capitalism, and sexism and patriarchy, right, are making us grapple with these in different ways. I think that is distinctly true, but without having this intersectional lens, right, I think we tend to erase, right, the different experiences that we've all had, and that there have been women at the table making these claims for decades that we're now paying attention to. So I think it's so important to center the voices of the most marginalized, because they've been thinking about this for longer, right? They've been dealing with this for longer. They've been thinking about strategies of how to get this done. And in my interviews, right, people have talked really earnestly about these sister networks, about how this nuclear family structure doesn't work. And we know this, right? Like, people that have children know that how difficult it is to take care, or not even, or elder care, right? How difficult it is to take care without having some help. And so women of color have been building this fictive kin networks, right? Other mothers, aunties that are helping to deal with the familiar load at your house that just is outside of the American, in particular, like, norm of what family life should look like. That's just one example. But if we were to expand or think outside of the box, not just like, this is what Jen was saying, like that we've basically privatized what we've already been doing, but this could be a very transformative minute, right? Where we can actually look towards people who have had to put forth their own prescriptions for making life tenable. Maybe that should be the model, as opposed to just saying, we'll just add money to the things that we know that don't work or only work for some, but trying to make the table bigger and more expansive might give us a different set of solutions.
Yeah, I really appreciate that perspective. And I have several other questions related to that, but I think Farida has some questions too, but at that, being able to leverage the moment, given all of the intersectional issues that you highlight, being able to leverage the moment to then create sister networks across policy, or kin networks across policy, might, as you say, hopefully be a transformative moment. So Farida, do you want to take over with the questions?
So what I'll do is I'll save my questions, because I'm lucky enough to be able to talk to my colleagues who are also my friends anytime. So what I will do, though, is make sure that we at least put out on the table a couple of questions from the audience. Karen said, we have long argued that evidence and gender disaggregated data will promote change on gender inequality, having looked at this in the UNFCCC for almost a decade now. That does not seem to be the case. If states have no shame in failing to meet their gender equality obligations, what do we do next? Who would like to take that question?
I would love to jump in on this question about gender data and the importance of gender data. And so I think that there's two separate things that happen around the narrative construction and the policy call for gender data, and especially gender disaggregated data. And so absolutely we need better data, because we are researchers and we want to have policy informed by the reality of lived communities on the ground. And so we need data that is intersectional, that is disaggregated, that is sensitive to the diverse experiences. No argument here. And, I sit in a lot of international policy circles. And so, I always joke, if I sort of, ate a piece of chocolate for every time somebody said more data, I would probably need some serious health attention. But I also think that there are absolutely situations where we have the data, we know the problem, and when some calls for more data are excuses for inaction and there are reasons to delay. And I think we need to be attentive to these two different scenarios. And I actually want to just pick up on Nadia's comments. Nadia, you are 1000% correct about everything you just said, as always. But I think it is telling that now we have a policy conversation relative to the needs of the most privileged, right? That now the crisis of care is touching on more privileged women. And so it's front page of the New York Times every day in ways that it wasn't when it was something that was just affecting minoritized and marginalized community members. And we're still not getting any policy action. So even when the policy touches upon the most privileged sets of women and there's still no serious moves, I think that tells us something, right? And so, I'll give you an example from the Northern Ireland Feminist Recovery Plan. I mean, these Northern Ireland women did so much work to gather data and gather intersectional disaggregated data around the dimensions that are important in Northern Ireland, around religion, around rural women, around migrant women, around women in predominantly agricultural sections, right? The dimensions of marginality vary country to country, and it still fell on deaf ears. Right. And so I absolutely don't want my question, my sort of saying we have the data, we need action to say that like that's enough data from the perspective of good public policy. Of course not. But I do think there is a sense where, think about violence against women. We have known for a long time that women are predominantly affected by gender-based violence, that it is exacerbated by all the different intersectional and minoritized identities that women have. And we still don't have solutions. And so I do think we need to hold governments to account when they're hiding behind calls for more data to excuse their lack of action.
Thank you, Jen. Georgetta has a question that is this, I'll just read it. Much like LGBTQ victories have been achieved with straight allies, the gender gap may need to be addressed by educating men. Do any of the panelists want to comment on what is being done and where in this respect?
I could say something about a structural change that I think has been really positive in some countries. So for example, in Sweden and in some other Nordic countries, what they did is they set aside daddy months in terms of childcare. And this research has suggested this has had really widespread effects on how men and women think about gender equality, because it's these months that after men have a child, they use it or lose it. And so a lot of men are taking up these daddy months and spending time in, kind of in the trenches, doing the childcare on their own. And so you see this kind of long-term effect in the change of the culture and the change of how people are interacting with each other. And so that's, I think, one example of how you can kind of change some of the narratives. But I think also to say that as we see with a lot of marginalized groups, it's always the group that's the most disempowered that's expected to speak for those issues. So when it comes to talking about the need for gender equality or racial equality, it can't always just be women or Black persons or, people of low socioeconomic status have very little voice, so they're very less likely to have a voice. But that we need to make sure that that men are speaking to those issues too. But I'll turn it over to my fellow panelists who are going to have thoughts on this.
Yeah, I don't have anything positive to say. I was just thinking this is so great coming from Katie. So the legislators that I've spoken with are telling a different story about how they're doing things on their own, right? They're no longer waiting for sometimes for Black men to get on board, that they are leading this legislative charge to help ameliorate some of the crises that are happening for Black women, femmes, Black women assigned feminine or female at birth to themselves. And it's a different kind of story, right? Like in the work that I do, I show this as an empowering thing, right? That these women are now being elected and they are, taking the issues that their communities have needed to address and doing it on their own. But the flip side of that is this, is that question, right? What are the men doing? And unfortunately, right, it seems like the men have abdicated their role to not be allies, right? Because an ally signifies that there's someone that's sitting on the sideline and they're cheering someone on, but to actually, have a dog in the fight and try to, to do something and to be a full and equal participant towards making society more whole and equitable. And that is really, really upsetting, but also, like, as a scholar, it's puzzling because Black men and even Latinx men, scholarship has shown, have a more feminist consciousness. And it's usually because they've seen their mothers, their grandmothers, their sisters have racialized gendered issues. And but yet they do the same thing, right? So it's very, very puzzling. So like in the literature that's just on like political thoughts or political, but they don't translate into political behavior, which is infuriating. So the same people who can say that they can check these markers to say that I understand a need for a Black feminist ideology, then go ahead and reify really harmful positions. And I think it's, basically, right, patriarchy is a hell of a drug, right? Like if you're diminished by race, then you try to up your social status by buying into sexism and patriarchy.
Frida, may I jump in real quick with a comment?
Of course.
So I think that, the question about education, what can we do? What are men doing, or what can men do? I think that right now we are, as a society, we find ourselves in such a unique place, such a polarized world, right? Within such a polarized world. I think that education begins within our school curriculum. And within our college curriculum. So, for example, let's not have our students just talk about what these concepts are, but let's provide them opportunity to actually engage in some sort of efforts, towards making a better social impact. So, for example, if you're talking about feminist frameworks, well, let's offer them experiential opportunities. And I know, Farida, your institution, and Katrina, your institution, you guys do that, provide them experiential opportunities to see what that looks like and prepare them. Because I feel like as society, men are lagging behind, not maybe so much because they don't know or they don't want to, but also maybe they just don't know how to, right? Because this is also a new space if we think about it for them. And so especially at our school boards, at our local levels, if we look at, across the country, there are so many books that are being banned. There's a lot of part of our educational curriculum that is not being allowed anymore, right? Without going into very specifics. So I think that the starting point really is there, because we need to prepare boys and men to understand what this transformative society looks like. And I honestly believe this is all part of our rebuilding back better, because COVID-19 pandemic has just kind of, as Nadia mentioned, these things have always existed, right? These challenges have always been there, but now we can't ignore them anymore. Like, we have to do something. So anyway, that was my comment. Thank you.
Thank you so much. I know that we're past time, and I want to respect everybody's schedules, as we know everybody's balancing so many things. But I just wanted to give you my heartfelt thank you for being here, for attending, for presenting, for our panelists, to Nadia, to Jen, to Katie Bolzendahl, to Amina, and of course, Blue Ridge Foundation, and my co-partner in this whole discussion, my co-moderator, Katie Powell. Thank you so much for being here and for contributing to what I think is a really meaningful dialogue that hopefully we can continue over the years and do what we can to make things better. Thank you so much.